Hi, this is Pendo. Welcome back to Millionaire Babe. Today I am in location in Dallas and I have an opportunity to introduce a very important lady. She has a plethora of knowledge in terms of mental health and just mental health awareness. I feel like there's a lot of knowledge that she can share, not just with the individual but even the greater community here in Dallas and the United States. I want to introduce you today to Maria Bundy. Welcome to Millionaire Babe.
Thank you so much, Pendle, for having me.
So tell me a bit more about yourself.
Well, my name again is Maria Bundu. I am I'm Tanzanian. A lot of times people, when they hear the name Maria, they think I'm Hispanic but I'm Tanzanian. I live here in Dallas, Texas, and I'm a psychiatric nurse practitioner with a doctorate degree. And I have been practicing here in Dallas for over 5 years in the field of mental health, psychiatric care.
Okay, so what made you interested in getting into mental health?
Well, it's a long story, but it's an interesting story. So originally, my mother was a nurse. My father also was a nurse. I have had a lot of nurses in my family, but I was reluctant in going to the nursing field because, like most people, I don't like blood and I don't like to see people get sick. But she really insisted that nursing was the way, and I'm really grateful for that. But I went to nursing in California, did my undergrad, and then worked in telemetry, which was cardiac and neuro telemetry. And I was there for about 5 years when I realized that I love helping people. I love talking to people and finding more of how I can help them emotionally, kind of fill the gaps that they may have with their medical health. And a friend of mine told me, like, well, you can do mental health, because I was actually going to go in education so I can educate.
Oh, okay.
So I was like, this is the way to go. And she's like, well, try mental health, look into it and see if you like it. And that's how I was introduced to the mental health field.
Great. So how has been your experience so far in the mental health field?
To be very honest, I think this is my calling. I feel like there is a need for more mental health providers because there's still a big lack of providers in the field, and there's a huge stigma. And my experience of being in the field has been very positive, and I feel like it has allowed me to make an impact in the lives of many people.
And what are some of the other challenges that you see in your practice?
Well, as you know, the field of mental health has a lot of disparities. One, there's issues with access to care, because for a long time and still currently there is not enough providers. And then some of the other challenges is that even though nowadays we're getting to a point where we're having a lot more psychiatric nurse practitioners and providers, there's still a lot of stigma of getting mental health services. So there's still a lot of groundwork that we as providers and we as a community need to spread the word on getting the access to allow people to break free of the stigma so that they can get the right care that they deserve and the right care that they need.
Yeah, so you talked about access to care. Does that have to do with people not having insurance, or they don't have the right insurance, or?
When I talk about access to care, it's at many levels. Some insurances don't cover.
So you talked a bit about access of care, and what do you think that some of the things that we can do to help bridge that gap?
Yeah, like one thing that I've mentioned already, I know a lot of schools are providing psychiatric mental health programs to be able to train more psychiatric nurse practitioners. The other thing that definitely is out there and growing is people actually talking about it. You know, being in social media. Everyone is in social media nowadays. Everyone is on Instagram, Facebook, YouTube, but really being able to educate people with the right information about what mental health really is. And mental health, knowing what mental health is and what mental illness is. And you don't have to be afraid to go and ask even just your primary care provider to do a screening if there's certain indicators or there's certain concerns that you may have or your child may have or a family member may have. So I think one of the key opportunities to really decrease the stigma of mental illness and mental health in general is actually for people to have conversations about mental health, mental illness, and the access to care, and that there is providers out there willing and ready to care. And that just because you have a concern about it, it may be something just very small, or it may be something that really needs attention.
And right here in Texas, do you feel like most of the providers, like the nurse practitioners, do they have the right autonomy to practice at their highest level of care?
It's interesting that you say that. In the state of Texas, yes, we have to have a supervising provider to oversee nurse practitioners, and not just psychiatric nurse practitioners, primary care nurse practitioners as well. But more and more states are giving nurse practitioners more autonomy to practice and to be able to have their own practices without a supervising provider. And I think the way that the wave of the world is going and the need that is there eventually, I'm hoping that nurse practitioners, psychiatric nurse practitioners will have more autonomy to practice and to be able to care for patients. And I'm really looking forward for that one day that the state of Texas will have that for us, just like some of the other states that have more autonomy for nurse practitioners.
Okay. And if I, for example, had a family member that I was concerned about, like, when do I know when to call for help? What are some of the things that I should be looking at?
Very good question. One of the most important things that I try to educate people is that if there is a concern that your family member, your child, brother, sister, cousin, student has any type of mental health issues. And when I say mental health issues, it's such a big word, you know. I always like to break it down a little bit. If there's concerns of depression, if there's concern of anxiety, eating disorders, and of course the big one, if there's concerns that someone may have maybe suicidal thoughts. Number one, if there's anyone that you have concern having suicidal thoughts, there's crisis hotline you can call. There's crisis hotlines that you can call to seek help for immediate care, especially for someone who is at risk of suicide, or if you yourself are having suicidal thoughts. Now, if there is concerns of things like anxiety or depression, I always urge parents and everyone to talk to your primary care provider. It's easier that way, right? Most of us have primary care provider, but if you feel comfortable enough, you can make, yeah, and if you feel comfortable enough, you can just make an appointment with a psychiatrist, or you can make an appointment with a therapist and just get an evaluation. The initial evaluation is to evaluate if there's something really going on there. And I always say there's nothing wrong with getting evaluated and be told, hey, there's nothing going on, you know? And if there's something actually that's going on, at least you are in the right place. The primary care providers have done a great job, and they're still working on being able to screen people. That way, when they see that this individual is having issues with depression or anxiety or some other type of mental illness, then they will refer you or recommend you to see now a specialist, a psychiatric nurse practitioner, a psychiatrist, or even a licensed professional therapist to do therapy. So they are working on that end, and I commend them for that. And I wish that we can do more to refer out so that we can be able to help people with the right providers and the right specialists.
Yeah, and I work in critical care, and actually, one of the screenings that we do for everyone that comes into a facility, we have a standardized screen test for suicide ideation. We also do screen tests for any mental health issues, domestic violence that could be in the home. So I guess most of the hospitals right now are trying to streamline mental health issues with their overall care. So I think at least that they're in the right direction, but I feel like maybe more could be done in that aspect.
Definitely. I remember when I worked on the telemetry floor, I worked on a stroke floor, neurotelemetry. So the majority of our patients that were coming in were stroke patients. And you can only imagine a stroke, how it affects someone's life. You know, some of our patients, or many of our patients, will leave the hospital, you know, paralyzed or have some type of issues, you know, speech. And at that time, even though they were being screened, like, we weren't sitting there and like, okay, you need to go see a psychiatrist or a therapist. How great would that help their treatment if they can be able to talk to a mental health provider to even help with coping with some of the medical situations that they're in. And not only that, I actually remember reading an article on individuals who've had cardiac issues and them talking to a mental health provider, and how that helped them actually help them, what's the word I want to use? Help them be rehabilitated much easier, you know? Remember, when a stroke patient comes in and they have weakness, they have to go to physical therapy. There may be some physical things that have changed. Their speech has changed. And imagine having to cope with that. You know, it's already hard for the patient. It's already hard for the family. The majority of them have to have a complete lifestyle change. So having a mental health provider, a therapist, or even a psychiatrist kind of evaluating and see where can we help them with their mental health needs, I believe that it will greatly help them in the process of getting physical therapy, and the process of actually recovering and coping with some of the deficits that they've had, or even just the trauma that they've had with their medical condition.
Yeah, because you see, in most cases, for example, if somebody has had a stroke, the cardiac related issues, and they have some psychomotor or neurodeficit, usually you find other specialists, like, speech pathologists, if it's maybe like they need help with dressing, they'll bring other type of people, therapists.
Yes.
Most people don't really think about mental health issues unless they're like behavior trends that they're seeing in the patient. Maybe the patient is agitated, compulsive, not taking, and maybe like they're not taking their meds. So basically what I'm saying is that maybe sometimes we think of mental health issues too late.
Yes.
And yet maybe we can find better ways of incorporating mental health awareness and just being able to screen these patients for mental health much earlier before we start seeing those overt signs of behavior issues.
Yes.
So,
Definitely. I mean, you've named all the different factors that affect a person after going through a traumatic experience. And with your experience in the ICU, imagine that's a traumatic event in someone's life, you know, from just being able to sleep at night, you know, all the sounds or all the other different things, but then the traumatic things that are happening with them having to experience that financially, physically, and then after that, as providers, we want them to make drastic changes that are going to help their life, you know, being on a cardiac diet, you know, losing weight, being on a diabetic diet, and we give them that information and say, okay, go home. Go home. And people are going to their home and they have to process what just happened in their lives. So, like you said, I mean, yes. So, like you said, yes, I wish and it is important for mental health referrals and recommendations to be done earlier on. And I ask myself if I was in that position, because I've had some health challenges, you know, if I was in that position where I was in the hospital and I had to go back home, how will I be able to handle all that? You know, I ask myself that question. How mentally and emotionally, how will I be able to handle that? So, like you said, Pendo, it is very important. Mental health is very important. I mean, waking up, being able to process, being able to cope with some of the stressors, you know, it's a big deal. You know, we worry just about the heart, you know. Everybody's like, oh, heart attack. I mean, it's important. Don't get me wrong. It's important to take care of your heart. But if you wake up and your mind is just not quite right, it affects your perspective. It affects the way you view your world. It affects the way you interact with people. It affects about your choices that you make. So your mental health, my mental health, our community's state of mental health is really important.
I agree with what you're saying, and actually, if you look at looking at health, most people, like you say, they focus on one aspect of health, but in order to be a completely functional human being, you really have to be whole.
Yes.
So you have to be mentally whole, spiritually whole, and financial too. You know, so I really stress a lot about the financial wealth, financial growth in women, because I feel like if more women had the knowledge and the expertise on how to manage their finances, not only does it take out that stress of having those day-to-day bills, day-to-day living expenses, but you also, as a woman, you want to have something to leave to your family, to your children. And you know, also as a woman, you want to have something to leave to your family and your children. And if you look back, me, you know, growing up in Africa, because I'm half Uganda and half Tanzania, and if you look at some of the rules on like distribution of assets, many women didn't actually have access to ownership of assets. They couldn't own land, they couldn't own any property, and in most cases, if they were in a household, the only way that they could actually get any assets was either through marriage or inheritance. But in many cases, women did not inherit anything, even from their own families. And over time, I mean, this has changed. We've had some changes right now in Uganda and also Tanzania, where we both come from. But I feel like it's still important for women to be financially literate.
It is very, very, very important for women to be financially literate. I think that we're making headways with people like you, educating women on how to manage finances. Not only that, but even professional women. You get a degree, you start working, but not everyone has a formal class on how to handle and allow their monies to grow. It's easy to get the monies and spend it. Everyone loves spending, right? But how do you allow your money to grow? How do you create financial security, not only for yourself, but for your children? There are many women who have had families or husbands who are very successful, but when they're gone, how do you continue being financially successful? How do you continue to have financial security unless you have the skills or you have someone helping you manage it? And I think, we even need to start a little bit earlier. We need to start with our children, teaching them financial literacy, teaching them that you don't have to buy everything that pops up for Christmas. And how do you save, and how not only save, pretty much a lot of us learn how to make money, how to save, but how do you make it grow? So definitely that is really important. And in what I see, finances is a big stressor in a lot of people's lives. Finances can cause a lot of insecurities. It can cause a lot of anxiety. Lack of finances can cause a lot of depression. Even it can cause divorces and relationships to break down. So finances is a really big part and a big aspect of our families, and something that we need to learn as women, something that we need to learn overall on how we can not only manage and control our finances, but how do we in turn teach our children how to manage that.
Yeah, you're actually right. Actually, there were some statistics that say the number one cause of divorce here in the US is related to money. Money fights, how people spend their money, how they save, how they invest. Because I'll be honest with you, even if, like, for example, if I take all the time in the world to secure my finances, but I end up marrying somebody who's not financially literate, that person will not only erase all the hard work that I've done over the years, but will actually ensure that I end up in bankruptcy. So the kind of partner that one gets is just as important as any other decision that you make in your life. It's actually one of the greatest decisions that you'll ever make in your life.
Definitely. When we talk about financial literacy and financial security, I mean, we're talking about life insurance, we're talking about retirement, we're talking about being able to have enough finances to when you're not able to take care of your. Yeah, so imagine if you're sick in the hospital or you lost your loved one. How are you going to have the finances that you need to take care of yourself? How are you going to manage your home while you're in rehab? Those are a lot of questions that are important questions and things to plan for ahead of time. And with all the health issues that we have here, chronic health issues that we have, is something that cannot be ignored. So talking about finances and health, your financial health, that is really important because it will affect you emotionally. It can affect you in your marriage, like you've mentioned, we talked about. And just having that sense of security really is important. It's important for everyone. Yeah. Not everyone can afford it, that's another thing. So how can we manage our monies so that we can have what we need at the time that we need, and we're not just talking about, I'm a millionaire and I have all this money just sitting there waiting for me in case I'm sick. But as a mother, as a single mom, or as a single family home, is there anything for emergencies, or how can we cut and budget and save or grow what we have? Everything has to start from somewhere, right? Not everyone has a luxury of waking up and inheriting a whole lot of money. A lot of people are out there hustling and working hard, my mom worked 2 jobs, and getting there, it's tough. But guess what? Having the knowledge gives you an edge up. It gives you an opportunity to be at a better place.
And just to stick with finances, like my mom comes from a tribe in Tanzania called the Pare. And if you know anything about Tanzania and the Pare tribe, they are really frugal people. And I feel like I learned most of the things that I needed to learn about saving just from growing up in such environment with all the upbringing, all the knowledge that my mom had, just being a Pare. So how do you think that your upbringing might have really influenced your financial growth?
Well, definitely my upbringing has really influenced my financial background, even my education. I'm also Tanzanian, but I was born in Tanzania, but raised in California. Raised in California. I came when I was 8 years old. So, like many generations of, individuals who were born from immigrant parents, I was raised in California, but my parents were African, so some of their relationships with money was different, Some of the most important thing was education, get an education, get a good job. At that time, nursing was what was really hot, so everyone went into nursing. If you got into nursing school, you are set, Then the next thing was to work hard. Buy a house. If you were financially stable, one definition of that is that you were a homeowner. I mean, that was like the top of the top. And if you worked harder, extra, then you built a home back home.
In Tanzania.
So in Tanzania,
yes.
Whether you live there or not, that's another story for another day. But those were some of the values that came with finances and money. But I never really heard of growing your money. 401k, I started hearing that a lot later, and my parents now were a little bit older, and they're like, okay, we need to, save, and we need to do 401k and healthcare. And I remember another interesting story was that when I was in college, my mom had this thing about credit cards. Like, don't you dare get a credit card. Credit card was just like the evilest thing that you can do. Like, it will mess you up. But imagine, I wish she would have told me how I can build my credit and have a credit card and how to manage it, maybe I would have had a healthier relationship with credit cards, you know? But it was such a big thing. It was such a big, scary thing about having a credit card. And so I think some of those things that we have been taught at a younger age, those myths that we've been taught need to be taken care of so that we can be able to manage and have an understanding. Like, it's not bad for you to have a credit card. It's okay for you to build your credit, you know. You don't have to just save money in the banks. You know, you can put it in the stock market. You can invest it in homes. You know, just looking at the different avenue and really getting better knowledge on what a healthy financial freedom looks like. You know, rather than, hey, first thing you gotta, you know, get the education, get the job, and work, and have, you know. And so it's a new era, and I love what you're doing and the information that you're giving us out here, giving women out here, empowering not only women, even men. I mean, it's something that goes, you know, something that we all need, you know, to have that financial freedom and to be able to understand how our monies can work for us, where we lack, and what our issues are in relations to money.
Yeah. And what are your 5 or 10-year goals, Dr. Maria?
I got a lot of things. That's an awesome question. For me, I have a lot of goals. There's a lot of things that I really want to accomplish. And I know I need to answer this directly, but let me tell you a little something. When my mom passed away, my views on goals and finances and retirement and healthcare really changed, because she died from cancer at a young age, early 60s. She was still working, still strong. She, like I said, she was a hard worker. She had built homes, but some of those homes she never really got to enjoy, you know. In Tanzania, yes, in Tanzania. She never really got to enjoy. So some of my goals, number one, really is the goals are all related to self-care, being able to enjoy, but still being able to invest for situations such as that, because we don't know where we'll be in the next 5 years or the next 10 years. One thing that's really on top of my list is being able to educate people about mental health, both here and in Tanzania. Mental illness is still a big stigma. We've lost a lot of people. You know, there's this verse that says, my people perish because of lack of knowledge.
It's actually the actions that you do that will make the difference, because getting knowledge is good, but it's just one part of it. It's the actions that will make a difference.
Definitely well said, because even in the access of care, we want people to take action. We want people to be able to take actions, to talk to their providers and to move forward. But besides that, the other goal that I have is financial freedom. Just like a lot of us out here, we are wanting to have that financial freedom. I want to have growth and
financial freedom.
Yeah, financial freedom and growth. I want to grow my business, and also I want to venture out and have things that can make money for me without me being there, you know.
And just in retrospect to what you just said, actually just want to say that I'm very proud of you, and I'm very proud of what you're doing here in the Texas, and you're also an entrepreneur, and you actually have your own clinic here in Texas. So that's a big thing, where you're not only just provider, but you're also an entrepreneur, and you're helping other nurse practitioners in the field to get acclimatized into their field too. So really, congratulations for that. That's a big move.
Thank you, thank you. I'm humbled by that, and being in that, having that opportunity to work with other nurse practitioners, and I've had students come through. Yes, so working with other nurse practitioners, I've had students come through, and some of my students actually have their own clinics now. So it's such a pleasure to see the growth in people, and also grow individually, and try to get to live the American dream that, my grandfather and my mother, and those who've come before me have allowed to put a pedestal, so that I can also rise. I can also help other women rise, and other people meet their dreams and goals. Yeah.
So I just want to give you another big congratulations, boss lady.
Oh, well, thank you.
From one boss lady. So I just want to give you another congratulations from one boss lady to another.
Oh, well, thank you so much. I'm humbled by that, boss lady. And I can't just wait to see all the different videos that you've been putting out there. You've had some amazing people come on here, and remember, the one thing I always try to remember, to remind myself that the sky is not the limit. There's always growth. I'm always learning different tricks, learning different things from you and some of the people you've had on your show. So I'm really humbled by that. Yeah, and you've had such amazing people who have come here, and I've learned different nuggets and different things, and I'm just humbled by being able to talk to you, and being called boss lady by you, Millionaire Babes, and I'm really proud of you too, and thank you so much. I'm really humbled. Thank you.
Okay, in ending, where can we find you?
You can find me.
Okay, and where can they find you, Dr. Maria?
You can find me on Elevate with Maria on YouTube.
Okay. Okay, guys, it's been a pleasure having you. I hope you enjoyed this episode. This is Millionaire Babe, and I'm with Dr. Maria, signing out. I will see you guys next time. Good night.